So that's the kind of the mental illness approach. And then if you bring in the flourishing approach, so it's related but different. And then this allows us to build up a complete state of mental health. So if we think about this at a population level, and what the research shows from the big epidemiological studies that have looked at this, and we don't have this research from New Zealand yet, but we'd like to do it. But we, in terms of mental illness, we do have similarities with countries like the UK and the United States. And where they've looked at flourishing there, you get data to inform this picture. But what you'll notice about this is that people who might have a serious diagnosis of mental illness can still and do flourish, which is that's really great and very important, because of when you've just got this singular model here, then people who have serious mental illness are often denied in people's minds the opportunity to flourish. But we also have this group down here, people without any significant mental health symptoms who are languishing. And that's a group we don't really talk about, but was reflected in that first quote that I read out. So this group is although they're not diagnosed with a mental illness, their mental health is not great. And then we have people in this area with moderate mental health. So what the research is showing is that probably only around about 20% of people might be flourishing in our Western affluent societies, which isn't really that much. We've got about 1 in 5, as you know, people experience a mental illness in any 1 year, so roughly another 20%. So even if these figures are a bit fuzzy around the edges, that leaves a huge group in the middle who aren't diagnosed with a mental illness but don't have the best mental health either. And that's a big, that could be around 60% of the population. So with this total state of mental health, we can start to think about social policy in different ways. So why would we want to make the 60% in flourishing a public health issue? Is it just something that people should work out for themselves as individuals or in their families or whānau? Well, the research that's being done is making it clear that whether we're flourishing or not has a major effect on our health overall. For instance, this is from the United States, unfortunately, but from a social policy perspective, you can see that if we're not flourishing, it does have a big effect on a range of health and social indicators. Furthermore, the research is showing that benefits of flourishing is that it overcomes some of the pervasive fear that's out there in society, which tends to close people down, feeds discrimination, racism, and inequality. And good research to show that people that are flourishing have more empathy, broader ways of looking at the world, and it creates an upward spiral of resilience. So you can argue from a public policy, public health point of view, that anything less than flourishing is going to be a burden on society. The current view is that it's just diagnosed mental illness as this burden. But when you look at the total state of mental health, anything less than flourishing is actually a burden. So that's why we're saying mental health should be everybody's business, that it's a total state that we all need to be looking into and thinking about. And going into the future, if we want to survive as a vibrant country with a reasonable economy, skills like creativity, being able to manage complex social relations and so forth are going to be very relevant to the kind of modern conceptual economies that are developing around the world. So what we want to do is to just collapsing that total state of mental health into a population bell curve. Sorry, getting a little bit technical, but just to introduce you to some of these concepts. the idea is to look at the whole population, and there's good evidence from public health literature to show that that you can get really good gains by focusing on the whole health of the population. Our current health policy tends to focus very much just down the problem end, but there is good evidence to show that if you focus on the health of the whole population, see the population as a whole, then you can actually get benefits for everybody. And a general increase in flourishing. And yeah, I won't go into any more detail than that, but that's kind of an introduction to some of the public health concepts behind this. So how would we increase flourishing if we create this demand, which hopefully we will? Well, increasing affluence isn't going to do it. What we believe we need to do is advocate for the social conditions that will increase flourishing, and also the psychological conditions, and take this whole population approach to it. It's about looking at the underlying problems, but also potentials in our society as a whole. And it's about reducing risk factors to poor mental health and lack of flourishing, and building on our strengths. And it's probably not going to have to cost a lot of money. It's more about a shifting of mindsets. So the things that we've thought about, just to give you a few ideas, because we really want to get your ideas and discussion this afternoon around this. But in terms of creating the social conditions that increase flourishing, things like reducing income inequality is going to be really important. That's reflected in that spirit level book that I showed you at the start. We can do things like think about social policy change, and this is from the UK, unfortunately, but it's a manifesto for a flourishing society put out by the New Economics Foundation, and you can just see the type of things there that from the research they've done into this would be social policy things that you could do to increase flourishing in the population. So things like, yeah, you can have a quick scan of them there. But if we're going to make these social policy changes, it goes back to that earlier point about we're going to need to have the public out there demanding this kind of change. So we need to think creatively about that, how that would happen. Because as I said before, if we're just the Mental Health Foundation or even all of us going to the government probably won't sway their minds, but if we have this mass interest, then that's probably going to make the difference. So those are some of the top-down psychological approaches that might take to increase flourishing. In terms of bottom-up, more psychological skills, I mean, we've already, last Mental Health Awareness Week last year, we used these winning ways to wellbeing, 5 simple evidence-based ways that people could, and people did, but there was a really good positive response to this because people found these things, those simple can do, and there was a lot of interest in this, and also it's a great awareness raiser that we do have some control over our psychological well-being that we can enact in our everyday activities.